Welcome back, everybody. This is Morning Live on SABC News. Thank you so much for joining us. Health Minister Dr Zweli Mkhize and some task team members briefed the public last night on South Africa's vaccine rollout program against COVID-19. But to get further clarity on the matter, we're now joined by Dr Zweli Mkhize, who's joining us via Skype. A very good morning to you, Dr Mkhize. Thank you so much for joining us. Welcome to Morning Live.
Morning to all the viewers.
Now, we know that South Africa is one of 200 countries in the world who have joined a pooled procurement process for the coronavirus vaccine. So why did the government choose the COVAX facility as a means of vaccine procurement? What are the advantages?
Well, the advantage of the COVAX facility was that for countries that are either low income or those that would have a challenge in financing themselves, they would have the safety of volumes where a COVAX facility would buy on behalf of many countries, and therefore they would be able to negotiate better prices at that level. The other issue was that the COVAX facility had 9 vaccines in its pocket, when in fact at that time it was not known which vaccines would be successful. And so it was very risky for a low-income country or middle-income country like us to make a commitment in one vaccine when we don't know what the prospects of that vaccine would be for success. And so COVAX facility was offering a possibility of a very huge chance of success based on the fact that there were 9 vaccines and that they would be in touch with the rest of the different countries to be able to pool resources, and therefore it would not be as expensive originally to actually put finances to procure. In the other vaccines, the cost was, the differential was quite huge between the cost of what we would have paid through the COVAX facility and what the rest of the other countries were likely to pay.
Okay. And is South Africa still negotiating directly with the pharmaceutical companies, Dr. Mkhize? I mean, when do these negotiations begin, and is there finality perhaps on anyone?
Well, we have indicated that there are negotiations. They are not finalized because, excuse me, because when we started with the issue of the COVAX facility, we're not able to start any negotiations because of the conditions that were associated with bilateral agreements. And then once there was a sense of success on a number of vaccines, we then started having our negotiations with the different pharmaceutical companies just to be able to see whether in fact there was anything that we could be able to do. Just remember that the COVAX facility was covering the first 10%, and we needed to ensure that at least some people we start with some vaccination. But later on, then we had to look at how the rest of the population that needs to be vaccinated would be financed. And that's how we started some of the bilateral negotiations with the different companies.
Now, last night, the founder of a medical aid company, Mr. Adrian Gore, and a reference to business were mentioned, and public-private partnership. Give us a little bit more clarity on this, Dr. Mkhize.
Okay. As we do this work, we engage a number of different teams of people to assist. So in the first instance, you recall that in September, we actually restructured our Ministerial Advisory Committee. We created one which was called the Ministerial Advisory Committee on COVID-19 vaccine, which is chaired by Professor Barry Shu. Now, this team of experts were then giving us a guideline in terms of what strategy we should use, what approaches we should use, what should be the approach to the vaccines. Even though they were not finalized, they were monitoring the situation. At a certain point, it became clear that we needed then to refine an implementation plan for the vaccination program. So we then set up in the department a number of structures to start working on refining this implementation plan. And then we then looked at that point that we needed a task team that would help us to augment the financing so that government alone is not the one that is financing, but that we could approach medical schemes, and we could also approach the private sector to actually work in partnership with government as part of the social solidarity to build up the resources necessary for the purchase of the additional vaccines. So this task team was set up at that point, and therefore that team's duty was to approach the medical aids and then all the medical aid as well as the private sector. So that work is going on right now. So once the work with these particular private sector groups have been finalized, we'll be able to make a necessary announcement. Right now, we're going through the process. We're just updating the public on the basis of what is being done, because there's a lot of anxiety about are we going to be left behind? Is the country able to, beyond COVAX, what else do we do? And therefore, we felt that the partnership between public and private needs to be secured so that you can get additional resources. So that work is being done. And so Adrian Gore is the chairperson of that task team. It consists of private sector people, as well as on the other side, it's people from government. So Mr. Adrian Gore is the one in his personal capacity, and then Mr. Lex Cochrane, and then there's also Mr. Sandile Zungu, and then of course then we've got Dr. Anban Pillay, Dr. Tulare, and Mr. Siwe Ngubane. All of them together work on looking at all, and Professor Perishu. So all of them together, they look at what resources, what approach we're taking, and therefore try and match the resources. So that process is ongoing. Even tomorrow, there'll be a meeting with a number of businesses to secure this additional partnership.
Now, Minister, how will we not run into the same problems both the United Kingdom and the United States are running into right now with A, the distribution, and B, with enough products? I mean, let's start with distribution. There is so much concern that the delivery platform is where it could all go wrong, and not to mention the possibility of theft, even though there will apparently be track and trace methods that will be used.
Well, I think there's always a risk, firstly, of a delivery mechanism that will have mistakes. We must accept that that is a possibility. However, because everything is being done under pressure, we are picking up these structures, and we're hopefully going to get participation of some of the non-governmental side, private sector, civil society, that will help also to improve the question of awareness of what things are going on outside a government's system. So we would work with the different structures of oversight at that level. And secondly, we have to obviously put in track and trace system. We have to also put up what we call an electronic registration system that will be able to record a central database, so we know who's been already given. So it is going to be quite a challenge, but we don't have time to wait until we've got a full, clear plan. We have to keep moving as things are happening. As you'll see how the vaccine was developed. It was developed whilst so many things were not done. So that's why it took the shortest possible time to be concluded. So everything is really working under pressure. We really think that everything would need to be done, to invest in the awareness of our community, so that they also assist in picking up areas where there might be people who are involved in the theft of the stock and any kind of irregularity. But this partnership is going to help us to ensure that both public and private are keeping an eye in terms of who is getting the treatment and how is the vaccination and how it's being managed. So if there are any problems, we hope that there will be early indications of people who are going to report, and so we can try and deal with that. But our biggest issue really is how can we invest in so much of awareness of society that we are able to get people to come forward as soon as possible, as soon as the system is able to handle those numbers.
Now, Minister, will you be keeping the public updated on the process with regards to the vaccines procurement program? Because many have commented that the information and indeed what the government itself has been doing is it comes a little too late.
Well, the problem is always, how much information do you give? Because if I give any information, there will obviously be things that are not ready. And so sometimes you try and prepare as much as you can, and therefore some people might feel, well, it's taken too long. But if you're doing the work, you can realize that there's a lot that needs to be done. And so we will keep the public as informed as whatever new developments may well be. But, in the process of informing the public, it's not always possible to meet the approval of everyone. What is important is that when there's additional information, it needs to be shared, and that when there are questions, we need to be able to answer them. When there is clear decisions, when there are clear agreements, we must even announce that those decisions have been done. In this case, we still haven't concluded some of the decisions. That's why we indicated that we are looking at the terms of agreements, we're looking at the in the non-disclosure agreements. All of those issues means that there are certain things we are not ready to confirm. But if you bear with us, the public bears with us, we will be able to update, because things are moving fast, and we're talking to many companies at, every other day we're talking to many companies, and things keep changing. And we're not just finding a fixed situation on the other side. We keep influencing them to change things, to accommodate more, to do certain things differently. So because that situation is fluid, when there's new information, we'll be able to share.
There's also concern about the efficacy and or efficiency of whichever vaccine or vaccines that we may receive. And reference was made to the South African Health Products Regulatory Authority last night. So how can the public be confident that we are receiving a vaccine that has full efficacy in testing and use?
Well, every vaccine that will be of interest to us must fulfill the basic WHO requirements of a certain amount of efficacy in terms of the scientific research. So the regulators, the SAPRA in South Africa, will look at those issues, and just to make sure that we don't just get any vaccine that's not gone through any process, our own regulator must satisfy themselves that the necessary researches, the reports are in place, and that the necessary requirements are also in place. So the regulator does recognize something that has been decided by other jurisdictions to assist in the decision making. But on its own, it's got to go through an elaborate process of analyzing the application. But in the process, they've put up a task team to pick up as much of the information on any of these products of these candidate vaccines, so that they don't delay in the process of registration. By the time they do, they would have ensured that the public is safe on the vaccine that would have been granted authority.
In the briefing last night, Minister, you described how the rollout process will happen in phases. So how was this tier system determined?
The Ministerial Advisory Committee has sat and analyzed the situation throughout the whole world and looked at which kind of part of the society is at high risk that needs to be given attention. Globally, the approach has been that your first target must be healthcare workers, because they must stabilize the health system without themselves falling sick of the victim, were the highest risk, because all of the people who have got the infection will end up with the health workers. So it becomes very, very important that they must therefore be put on the top of the list. Linked to that will also be what we call frontline workers, a number of people who will be meeting because of the services that they render. They meet with so many people, some of whom have got an infection, but they are not having symptoms, and therefore they pick up infection from people they don't know. So we need to make sure that those are safe. The third aspect has to look at the vulnerable groups, those who are elderly, those who have got co-morbidities. They've got to be focused upon, because the infection tends to do worse on those who have already got underlying infections, underlying conditions. And so, blood pressures, cardiac diseases and renal diseases, etc., cancers, etc. So those people need to be also taken as a group that must be dealt with, so that they must be secure in case there's any infection. They must already be secured. Because it's happening all at the same time, we have to follow those phases, and therefore there's a whole stratification of community groups, so that it must maximize our access to access of the different parts of the community on the basis of need. This is one time where vaccines are going to be made available across the whole population, not on the basis of who can or cannot afford, but on the basis of which category needs to get that vaccination first. And so that is the approach that we're going to be taking.
Okay. And what kind of processes, Minister, are in place to ensure vaccine safety? I mean, this with reports of allergic reactions and other ailments, in some cases, even after the vaccines were taken.
Generally, the issues of safety have to be recorded by those who administer the drug. So every health worker who will be administering the vaccine would then be able to look out for the any symptoms. But there is also a monitoring mechanism that gets put in place to record and monitor any reaction or any adverse outcomes of any of the vaccine administration. This is done to make sure that because in this case, what we call it would be kind of a post-administration surveillance of some sort, which means that we're looking up across all the recipients to make sure that if there's anything that's untoward, it is recorded fairly quickly, particularly because this vaccine was developed within a very short space of time. Yeah. On most of the other vaccines, there tends to be a long period of observing individuals' response after so many hours, after so many days, so that we are sure that the safety level is not a problem. In this case, the safety level has been established as being secure. However, just for additional security, there'll be continuous monitoring thereafter, after the vaccination.
Okay, we're out of time, unfortunately, Minister. But at what stage do we hope to vaccinate a large portion of the population to ensure herd immunity? I mean, once herd immunity is established, is there perhaps still a need to vaccinate the remaining population?
Well, look, in technical terms, herd immunity has been calculated to require about 67% of the population minimum. So we need to move as fast as possible and try and vaccinate as many people as possible. That is really what we want to do for this year, 2021, is to do as many as possible. Obviously, the other issues of logistics, of transport, of distance, of how many people can be vaccinated a day, and all of those will weigh in. But our target is to vaccinate as many people as possible of that two-thirds. Obviously, everything is going to depend on availability, quick delivery, quick delivery of the vaccine, and a whole lot of other issues. But our target is to try and do as many as possible of those who are targeted.
All right, Dr. Zweli Mkhize, great chatting to you. Thank you so much for your update. We do appreciate your time.
Thank you very much.